prolactin level is high, then it can lead to some miscarriages also. It can be dangerous if they conceive it at this period.
I have very heavy periods and those are very painful.
Painful, heavy bleeding is very much normal, but it is not normal. Poor gut health can lead to...
Is there any age for pap smear and mammography to be done?
PCOS is one of the problems that can lead to hair loss. It is also a very common problem in which there will be a certain vitamin deficiency, biotin. So fatigue is generally occurring when there is iron deficiency. Then it can also lead to oligospermia.
So if there are men and women who are trying to conceive, they need to take care of any other deeper root causes we should be aware of?
Yes, the main cause...
What if I told you there's a doctor who lives like a bodybuilder, eats like a monk, and holds multiple world records? Today's guest is not your typical doctor. He's a proof that fitness, medicine, and mindfulness can go hand in hand. Meet Dr. Baldeep Singh, a doctor, clean eating fitness freak, and a world record holder who is rewriting what it means to live a healthy and a powerful life. What sets him apart is his unwavering commitment to a clean lifestyle, disciplined nutrition, and a serious gym routine that's helped him build an extraordinary level of strength and stamina. He's not only a healer but a doer, a multiple world record holder who proves that science and fitness can go hand in hand, and his story is one of balance, determination, and redefining what it means to be a doctor in the 21st century. Trust me, this one's full of golden takeaways. Dr. Baldeep Singh, welcome to the show. It's a pleasure to have you with us today.
Thank you for having me here.
Okay, now let's start with the question on every woman's mind. Why are so many young women today facing hormonal imbalances like PCOS, irregular periods, and thyroid issues?
So, according to me, the main problem here is that they are suffering from some lifestyle issues in which they are taking some processed foods, poor sleep cycle they have stress, anxiety, and also they are not following a proper diet, due to which these factors are leading for PCOS. Other than this, there is also hormonal disruption which is taking place due to environmental toxins. Other than this, we can also say that certain women are suffering from insulin resistance and obesity. All these factors are together causing this problem such as PCOS, irregular periods.
So according to you, I think it's mostly lifestyle driven, as you said. Any other deeper root causes we should be aware of?
Yes, the main cause is obesity. We have to take care of our health. We have to take a proper diet. We have to follow an exercise plan under a proper guidance, under a trainer, so that our BMI don't go above 30, because it is one of the major cause for causing PCOS.
Okay, understood. Okay, doctor, can you break it down for our listeners? Like, what exactly is a hormone profile? Which key hormones should women be testing and when?
So basically, there are a lot of reproductive hormones that are tested generally in pregnant women. So first of all, we'll start with FSH, that is follicular stimulating hormone, then luteinizing hormone, that is LH, estrogen, progesterone, anti-Müllerian hormones, testosterone, prolactin levels. We can also check thyroid hormones levels such as T3, T4, thyroid stimulating hormones level, because these all factors are very important in case of fertility, metabolism, and mood.
Okay, so I think there are a multiple number of hormones that women need to take care, and this can be achieved with a proper lifestyle, proper diet, as doctor mentioned. Also, we often hear about estrogen and progesterone, but what about others like AMH? We have heard more about AMH these days on Instagram. So when do they matter the most?
Anti-Müllerian hormone generally matter during your periods, because disruptions of estrogen progesterone can also lead to disruptions of anti-Müllerian hormones, and that can cause different types of problems causing irregular periods, PCOS, and there are certain more dangerous causes which can cause heavy bleeding, such as endometriosis, leiomyoma, and etc.
Okay. Now, what lifestyle habits like sleep, caffeine, or workouts can actually disrupt hormones if done incorrectly?
So, saying according to me, sleep cycle is very much important. There is one hormone that is called as melatonin, which generally regulate our sleep cycle. So if our melatonin is okay, if we are sleeping at a proper time, melatonin will be released in good amounts. So generally we will not have any problems. And if we are performing good exercises under the guidance of a trainer or under a fitness expert, so that could also be not a problem if we are taking under proper guidance. And as you said, caffeine, excess of caffeine can be a problem, but taking it in a good amount, there will be no problem.
Okay. And I think this sleep cycle, caffeine, and workouts are not only for women but for men also. The same thing goes
Yes,
for men.
same thing goes for men also.
Okay.
Because it can further lead if you are not following proper diet, proper training, then it can also lead to oligospermia, in which this sperm count generally goes down.
Okay. So if there are men and women who are trying to conceive, they need to take care of their sleep cycle, have caffeine at right amounts, and also work out so that they can lead a healthy lifestyle and can produce a healthy baby. Next, I would like to ask you about how often should a woman get her hormones checked and at what stage in her cycle?
So first of all, there are different types of hormones that can be checked at different time. For firstly, we start with estrogen, FSH, and LHH. They are generally tested at second to third day of your periods. And if you talk about the progesterone, it is generally tested around 21st day of your cycle. AMH and thyroid can be tested at any time. And if we're moving forward to prolactin and testosterone, we will generally test it in the early morning.
That's a very clear-cut answer. Next, let's move to some medical red flags that women should never ignore. Because so many women normalize symptoms like fatigue, bloating, hair loss, or low mood. We have seen like every other woman is complaining sometimes of bloating or hair loss, or she's feeling tired or not having a perfect mood. So, what according to you are the 3 symptoms you see most often in your clinic that women just brush off but shouldn't?
So first of all, as you have already mentioned about chronic fatigue. So fatigue is generally occurring when there is iron deficiency. So iron deficiency anemia is one of the most important cause for chronic fatigue. Other than this, hyperthyroidism, hypothyroidism, these can also lead to chronic fatigue, and taking too much stress can be another factor that can lead to chronic fatigue. So due to which we generally do CBC, that is the complete blood set count, to rule out any if there is any anemia or not. Secondly, hair loss. It is also a very common problem in which there will be a certain vitamin deficiency, biotin, which is very important factor for our hair, and keratin is also present in that hair. So we have to take care of these things. PCOS is one of the problem that can lead to hair loss. Other than that, we also see cases of bloating, and this generally occur due to poor gut health. Certain hormonal disbalance can also cause bloating, and serious problem like endometriosis will further lead to bloating also.
Okay, so many things are actually linked with PCOS, and is that what I see? And as PCOS is rising, so I think these symptoms are also rising with that, and we women need to take care of our health a lot so that we can rule out PCOS from our life. Okay, moving on to next, I would like to ask you what tests or checkups should every woman do at least once a year, even if they feel fine physically?
So the health checkup that generally all the women should do, first of all, we'll start with CBC to rule out any anemia, and also to rule out any infections, because WBC, that are the white blood cell, will be increased in case of infections. Third thing, we can do thyroid profile test to rule out hypothyroidism and hyperthyroidism. We can also check vitamin D levels, vitamin B12 level, which are mostly deficient in case of vegetarians, and also in females we generally get vitamin B12 deficiency, due to which it leads to megaloblastic anemias. So moving forward, we can check the blood sugar level, in which we will check generally fasting blood sugar and postprandial blood sugar levels. We can also check about the lipids levels, due to which there can be hypercholesterolemia, hypertriglyceridemia. After that, we can go for pap smear. That is the screening test for cervical cancer, which is most common in females. We generally see young females having cervical cancers. After that, we can do a mammography for breast examination to rule out any breast cancer.
Okay. Is there any age for pap smear and mammography to be done?
Yes, it can be started just after you attain your puberty. We can do that test. In 5 yearly, we can do once in 5 years. So
Okay,
we can do
once.
the screening test of pap smear. There's no age. So it is generally puberty.
Once in 5 year. Okay, that's a very good advice. Moving to next. As I am a pregnancy yoga expert and have various clients of pregnancy, so I would like to have a section for those ladies who are currently pregnant. So let's talk about one of the most nutritionally sensitive phases of a woman's life. Why are iron, calcium, and vitamin D deficiencies still so common during pregnancy, even with supplements?
So basically, as you have talked about pregnancy and this deficiency, because in case of pregnancy, all demand increases more than the normal level. In pregnancy, we have to give iron, calcium, vitamin D in high levels, not at normal level, which a sedentary man and woman will be taking. So first thing is that increased demand. Second thing is that absorption issue. Poor gut health can lead to inadequate absorption, and third thing is that poor diet quality. This thing, if you are taking iron deficient food, so you will generally see this deficiency in that pregnant females, and they will be suffering from fatigue, pallor, as we have already mentioned the symptom for iron deficiency anemia. So these three things pregnant females should keep in their mind.
So, not only supplements, but pregnant women need to take care of their diet as well. Iron rich foods, calcium rich foods, and vitamin D you can get from sunlight itself. So, these things should be taken care of. Apart from that, you mentioned poor gut health. So, do you think that before conceiving, a female should actually cleanse her body or should give some time like 3 months or 1 month to have a proper gut health and then try to conceive?
Yes, that is correct. 1 month before you are trying to conceive, you should take care of your gut health and try to detoxify your liver. So there are certain fruits and certain enzymes. Green tea is very much important to detoxify our liver. So these things we have to take care before conceiving, because in future you will have no problem then.
Okay. So, if you are taking good care of your health before conceiving, it makes sure that you will not have any nutritional deficiencies in pregnancy if you are taking good care of your diet, especially. Next, moving on to what are the signs that a pregnant woman might be deficient and not know it?
So basically, first we will talk about fatigue. Fatigue and weakness is very much common in all the pregnant female. They don't know that they are iron deficient. They are doing their work, they are doing all their things. But when they come to our clinic, we came to know that they are iron deficient. So generally, normal hemoglobin of a female is around 12 to 15 grams, and mostly all the pregnant females are iron deficient and generally having 10 gram or 9 gram. So basically, first thing they have to note if they are having any weakness, fatigue, any pallor, or they are feeling any dizziness. So that is the time that they have to come to our clinic, because it is a sign for iron deficiency anemia, and it can be dangerous if they conceive it at this period.
Okay. So the main thing that I understood is they should get tested first and then only plan for the pregnancy, because I have also read somewhere that iron deficiencies can cause miscarriages. So it's very much important that we take care of our diet, especially iron rich foods. Next, can you give us one underrated food that's a powerhouse during pregnancy but often it's overlooked?
So there are a lot of foods that we can add, but for me, it's sesame seed is the best because it is rich in calcium, iron, and healthy fats. It is great for our bone, blood, and digestion. Other than this, we can take dates, almonds. These are also very rich source for all these calcium, irons, and vitamin E.
Okay, let's move on to another section where I have a few questions from my followers and subscribers that I would like to ask you. The first question is, what are some iron rich foods that we can consume daily so that to avoid iron deficiency?
So iron rich foods are generally carrots. You can take beet. You can take beet juice because these all are rich in irons. Other than this, in vegetables we can take palak, which is very much common. So you can take all these rich foods which are already high in iron levels. So we can take this food and try to maintain our iron levels.
Okay. I have one question on this. Many a times it is seen that when we take iron rich foods, people suffer from constipation or mostly with the iron supplements. So, any tip for that?
So basically, this generally occur due to because iron takes time to absorb. So we also have to add along with iron a vitamin C supplement, due to which iron absorption will be increased and they will not suffer from constipation. So vitamin C tablet we can take, or we can take oranges, lemon. So these are all rich in vitamin C, so that will increase our iron absorptions also.
Okay. Next question is, what is the role of prolactin during pregnancy?
So generally prolactin levels should be normal. In case of if we are trying to conceive, so prolactin levels should be normal. If we are trying to conceive and if prolactin level is high, then it can lead to some miscarriages also. That's why first we have to maintain our prolactin level to normal level, then only we have to think for conceive.
Okay. Another question, the last one is, I have very heavy periods and those are very painful. How to know that if it is endometriosis or not?
For this, we have to generally do a scan. For that, we have to do a ultrasound or transvaginal sonography. Then only we will able to know whether it is endometriosis or not. Nowadays, people are taking like painful, heavy bleeding as very much normal, but it is not normal. There can be lot of causes going inside it, which is a serious cause, such as endometriosis, leiomyoma, fibroid. These all things, which we will scan through a transvaginal sonography, and then we can rule out all these causes. It can be dangerous. So first we have to treat this cause and then only we can conceive.
Okay. So basically, you need to get checked if you are facing any such kind of issues. Thank you so much for answering those questions. Next, let's move to some personal or fun section, a rapid fire section. So I will ask you a few questions and you just need to answer in one word or whatever feels right. Coffee or green tea? What's better for hormonal health?
Green tea, of course, green tea because it is rich in antioxidants.
Great. So you ladies, ditch the coffee and go for green tea. Next, one myth about women's health that needs to go away.
That heavy menstrual bleeding and pain is normal. It's not normal. We have to think this. You have to get checkup.
That's a great advice. Next one, yoga in pregnancy, safe or risky?
Very safe. Perform under a certified trainer or certified yoga coach. It's very safe.
Great. Another one supplement you personally can't live without.
I think according to me it's magnesium because it is very helpful in muscle recovery, sleep quality and stress reduction. So magnesium supplements is very good.
Great. And I think we mostly leave that magnesium supplement because mostly the common supplements are vitamin D, vitamin C, vitamin B12, and others. But magnesium is mostly, I think very much overlooked. So thank you for putting that. That's a very good advice. So thank you, doctor, for sharing such wisdom. So, if that didn't make you want to pick up a yoga mat or rethink your wellness routine, I don't know what will. Big shout out to Dr. Baldeep Singh for dropping pure value bombs in this episode. Thank you once again, Dr. Baldeep, for sharing your energy, wisdom, and powerful insights with us. I'm sure every listener, especially women on their wellness or pregnancy journey, will walk away feeling more informed, empowered, and inspired. And there were so many takeaways for me as well. I learned a lot from you today. Thank you so much, Dr. Baldeep, for joining with us today.
Thank you, Healthy for giving me this opportunity to share some medical tips.
To everyone tuning in, if this episode sparked something within you, helped you learn, or simply made you feel seen, do me a small favor with a big impact. Hit that subscribe button so you never miss an episode. Don't just listen, level up. Share this with a friend or family member who needs to hear it. And comment your favorite part, what blew your mind. And hey, if you're serious about taking care of your body, your hormones, or your future family, Healthy Pinch is where it begins. Check out the links in the description to book a 1:1 session, explore our yoga offerings, or follow us on Instagram for daily wellness wisdom. You can also follow Dr. Baldeep Singh. I have posted his links in the description box as well. So just go and smash that subscribe button, tag someone who needs this. Let's build a wellness tribe together. Until next time, stay healthy, stay happy.